There's a lot to think about when it comes to building a new hospital, and joining us now to talk about the future of both medical as well as well-being needs when it comes to building a new hospital is Lennox Wong, who is the Chief Medical Officer, VP for Medical and Academic Affairs at the Hospital for Sick Children.
Lennox Wong. I'm a pediatric intensive care physician and the Chief Medical Officer and Vice President for Medical and Academic Affairs here at the Hospital for Sick Children. I'm speaking to you from one of the oldest parts of Sick Kids. The building that I'm in right now was opened in January of 1951, so a bit over 60 years ago, and at the time it was the largest and the most sophisticated, most modern children's hospital in the entire world. And it's safe to say that they couldn't have imagined back in 1951 the sort of incredibly complex, sophisticated work that would be happening at Sick Kids here today. We're in the midst of an amazing redevelopment here, and we're actually thinking about what the future of child health will look like, not just 10, 20 years from now, but really 50 or more years from now. And part of this is an exciting set of work that we call Project Horizon. It involves reimagining the whole campus, really rebuilding the Hospital for Sick Children from the ground up, not just the clinical areas, but also the patient support areas, which will involve things like innovative spaces for education and research. There's probably about 3 areas that we would focus or consider principles that we want to consider looking forward into the future. One of which is this idea of innovation. And healthcare these days is so much more than providing clinical care. Part of what we need to do is actually tie in the training, the education for future generations of healthcare professionals and research, and make this seamless across the whole campus. And so that enters into the consideration for how you might build a hospital and how it might look like, so that both research and education can take place in clinical areas, and that clinical care can actually infiltrate into areas where there might otherwise traditionally be education. Another area that's really specific to child health is being child and family centered. And in some ways, this is not a new concept, but it's one that's really entered into the way we think about spaces in particular. We really want to have spaces that allow families to be present by the child's bedside, spaces that really allow for play and activity and early rehabilitation, and also spaces that would allow for natural light. So in some ways, old is new again. The old-time sanitariums of the past would have open windows, they'd have outdoor spaces, a lot of fresh air, a lot of light, and we're looking to do this when we think about building the hospital of the future. And the final thing I would mention is that we have given a lot of thought into building inspiring spaces for the staff who work at Sick Kids. Inspiring and also safe spaces that really support wellness. In the past, very little thought was given to how we would ensure that staff would stay well when they're staying here all day and night, 7 days a week, throughout the year. And little things like having respite spaces for people to take a break, to take care of essential things like food and drink, and then also considering how light affects staff, because the circadian rhythm is really important when you have people who are working through the middle of the night on a regular basis. So when we bring all of these things together, I think we've got a very exciting next 10 years here at Sick Kids, and really thinking about the flexibility of the space that would really allow for medical innovation, and both along the lines of care for the children and families, but also thinking about having the capacity to be flexible and allow for things that we can't even imagine now to take place 50 years from now.